Hello, I'm Dr. Arpana Jain, Director Obstetrics and Gynecology, Fortis Hospital, Shalimar Bagh. Today we are discussing about a very important topic, that is endometriosis. First of all, let me tell you what is endometriosis. Uterus has normal endometrium lining which shed every month during the menses, and this endometrium goes inside our body also, which our body immune system clears it every month. If it doesn't clean every month, then these endometrium deposit on the surface of uterus, on the ovary, on the fallopian tube, or on the back side of the uterus. Sometimes on the distant organs like intestine, diaphragm, lung, and scars. And every month, as the endometrium grows, these endometrium which are outside the uterus also grows in size, bleed, and every month increases in size, leading to pain. And what are the symptoms? The endometriosis, how can we diagnose endometriosis? What are the symptoms with which endometriotic patient can present? It can be pain. Pain, it is painful menses. It can be premenstrual, menstrual, postmenstrual pain, and it is more than the normal dysmenorrhea. And this pain, for this, usually one has to take painkiller. Another type of pain is dull aching pain, lower abdominal continuous dull aching pain. If somebody is having, then we become suspicious of endometriosis. Another common problem with which the patient can present is abnormal menstrual cycle. It can be excessive menstrual flow, it is irregular menstrual flow, intermenstrual blood flow. It can have any type of pattern in endometriosis. Then one has to investigate to find out the cause. Another common issue which the patient can present in endometriosis is infertility. 30% of population has no cause of infertility. It is called unexplained infertility. Out of this unexplained infertility group, I will say most common cause is endometriosis, because endometriosis is very difficult to diagnose. So it is labeled as unexplained infertility. We have to extensively investigate to find out the cause of infertility. Then we will find out the cause. Then how to diagnose this then? It is very important question that if it is so difficult to diagnose, then what to do? It is most of the time it is the clinical diagnosis. If somebody is having intractable pain, abnormal menstrual cycle, difficulty, or not conceiving, then one becomes suspicious of endometriosis. For that, we can do a blood test also, that is CA-125. Usually it is raised in endometriosis. Another thing is ultrasound. If the woman is having ovarian cyst, then we can think of endometriosis, and to confirm that, one can do MRI to find out the endometriotic or chocolate cyst. But it is not in every woman. So sometimes patient is having infertility or intractable pain and we are not able to diagnose, and we are suspicious of endometriosis. In that case, one has to, the gold standard is doing laparoscopy. In laparoscopy, we can see the endometriotic lesion, we can see the endometriotic cyst, and simultaneously we can treat this condition also. But in each and every woman we cannot do laparoscopy, so we have to rely on ultrasound or MRI or clinical findings. Clinical finding on pelvic examination, sometimes we are able to find out endometriosis if it is on pelvic examination the uterus mobility is restricted or it is painful, or the adnexa is painful, then we become suspicious of endometriosis, and sometimes we give trial for treatment of endometriosis, and women improve with medicine, we think it is endometriosis. It's a retrospective diagnosis. What are the treatment available for endometriosis? Treatment for endometriosis, medical or surgical. Medicines, it mainly depend upon the profile of patient. If it's a young woman, young girl, or a woman, reproductive age group woman, or a perimenopausal woman, then we have to accordingly we have to plan the treatment. If she is a young girl, adolescent girl, having endometriosis, having intractable pain or menstrual problem, we have to think about the medicine. The main aim of medical treatment in endometriosis is to make women amenorrheic. If she doesn't bleed, the endometrium will not bleed. The endometrium outside the uterine cavity will also not bleed. So her symptom will improve. The main aim is to make her amenorrheic. The medicines which are available are hormone tablets, which can be given continuously. With that, she will become amenorrheic, she will not bleed, and her lesions will shrink in size, her symptom will improve. Either give medicine or the injections are also available to make her amenorrheic. If she is in reproductive age group, she has large ovarian masses, or she want to conceive, not able to conceive, then we can go for surgery like laparoscopy. On laparoscopy, we can find out what are the cause. If it is endometriotic cyst, we remove the endometriotic cyst. We will do tubal patency test. We correct her tubo-ovarian relationship, and after that, she can go for assisted reproductive technique to make her pregnant. If the woman is in perimenopausal age group and she is suffering from endometriosis and not responding to the medical treatment, then we have to go for surgery. In that case, if she want to retain the uterus, we can remove the ovarian cyst. If she doesn't want to remove, she doesn't want further pregnancy, and she is very fed up with the dysmenorrhea or pain or menstrual problem, then one can go for the hysterectomy along with bilateral tubal removal, but try to conserve her ovaries as she is in perimenopausal age group. If then then what is the recurrence rate in the endometriosis? I will say endometriosis is a recurrent disease. If we treat, we give medicine, the disease will suppress, but once she stop the medication, the endometriosis can reoccur. Even after surgery, one can have endometriosis again. So there is no permanent solution for endometriosis. The permanent solution is after completing family, if she is having recurrent endometriosis, and if somebody want to have a definite treatment, then the hysterectomy is the only answer. But for every woman, we can not think about doing hysterectomy, so we have to resort for the medical treatment. And in these cases, we need a long follow-up, because every 6 months or a year, one can go for ultrasound to find out whether she is having recurrence of endometriosis or not. So thank you very much, friends.